Midlife and later life depression that goes undetected and untreated increases the risk for dementia. And in this episode, we'll talk about what you can do to help reduce the risk of dementia by treating depression. The first is that you can screen for depression using tools that have been normed with older adults. And I'll link to another episode I did on just this very topic below. Two is to recognize the link between mental health conditions and dementia disorders. And this is really important for therapists because I'm going to be doing a series on the link between various mental health conditions and dementia disorders. Today, we're addressing depression, but the same is true for anxiety and substance use, sleep disorders, trauma. And so get to know the link between mental health conditions and dementia disorders. And this is because you, as a therapist, may be the first to notice signs of memory loss because these conditions increase the risk for brain disease. Three, and you know how to do this well, provide mental health care, provide psychotherapy to help address the presenting problem. Depression, that's what we're talking about today. But tune in next time, we'll be talking about anxiety. So provide psychotherapy to address depression, to treat depression. And that will help not only today with the person's quality of life and engagement in life, but down the road in terms of delaying or preventing dementia. The fourth thing that you can do is to refer and collaborate with medical providers. If you are noticing cognitive changes in your clients, you definitely want to be working with their medical providers to rule out any biophysiological process that might be happening that's creating the cognitive impairment, like vitamin B12 deficiencies, other metabolic issues and deficiencies like with dehydration or potassium or a urinary tract infection or something medical that might be going on, medication interactions, a new medication, and so on. And five, you want to be educating your colleagues, your clients, and their family members. There are a lot of misconceptions about what's typical with aging and not. There's a misconception that depression is typical with aging when it is not. There's a misconception that older adults don't change, so why would we refer them to therapy for depression, which is also not true. So change the narrative, flip the script, provide education on what is true so that we can detect and then treat depression when it shows up. I'm Dr. Regina Koepp, and this is your weekly mental health and aging tip.